Didn't you say once that it's not health care, it's sick care?
Actually, exactly what it is. We're not faulting doctors because the physicians are doing exactly as they are instructed to do, and the physicians are doing what they need to do to keep their license active, and they need to make a living. And if they don't do what they're supposed to do, they will be legally reprimanded. This is a representation of how you guys get energy. You need energizer batteries to run the engine, and your engine is your body. That's why I've got this man here eating. Whatever he's putting in his mouth is going to be turned into sugar. We're not here to discuss whether that's good sugar or bad sugar. I'm just simplifying energy is in the form of sugar that then goes into the bloodstream. And then it's filtered throughout the bloodstream to go to all areas of your body so that it ends up in the cell. Inside of the cell is where that energy is made. We have the blood sugar, has to go into the bloodstream, but you need this organ right here. This is called the pancreas. This organ is what's going to secrete insulin so that the blood sugar that's in these blood vessels will go into this cell in order to create the energy. There's the batteries. You eat to create some sugar in your blood. Your pancreas shows up with the hormone insulin so it can put it into the cell so the cell can make energy. Where is this energy going to go? It's going to go to power your muscles. It's going to go to your brain so that you can think and do all of the millions of things that go on every minute of your life that you don't even know about. This teaspoon represents sugar. We can only have, believe it or not, 1 teaspoon of sugar floating through our blood. If we have more than 1 teaspoon of sugar floating through our body, this insulin has to be secreted in greater amounts. The pancreas will say, okay, we need to secrete more insulin because we have way too much sugar in the blood. We need to move the glucose, the blood sugar, out of the blood so that we're not going to be toxic to the human body. So you guys can imagine, where is this extra sugar going to go? The extra energy that we don't use. It's going to turn into fat because we know fat is a storage unit for the unfortunate occurrence if a famine happens. The body says, well, let's just take the extra sugar, turn it into fat, and we'll use it another time when there's no food around. The other place it's going to go is, let's say you're out there like my dad, a road bike cyclist, and you're riding your bicycle 125 miles a week. Well, that's where some of that blood sugar is going to go too. So you see where energy goes depends on your lifestyle. Let's say you continue day in, day out, every day, every week, for years of sugar into the blood based on how you eat or how little you move. So what ends up happening is your body starts to say, okay, we're going to just work overtime. The pancreas is going to work so hard to keep your blood sugar at that 1 teaspoon of blood sugar throughout your body. And what happens to the pancreas when that goes on? It can become inflamed, what we call pancreatitis. You may feel it, you may not, but this is not going to be a webinar about pancreatitis. It's just a mention I make because a lot of you who come in here have had a bout of pancreatitis in the past, to the point that some of you have come in here who've already had cancer develop in the pancreas because of the disease process that can go on. Remember, if you have pancreatic cancer, it can be reversed. You just got to stop causing the problem that caused it to happen in the first place, which the body can do. But that's a topic for another day. When you have too much blood sugar, what does the medical industry call that problem? Yep, diabetes. That's when the medical industry steps in to say, your blood sugar's too high. They'll put you on Jardiance, they'll put you on metformin, or they'll put you on any of the number of drugs for diabetes. Here's the problem though. The medical industry expects that your blood sugar levels will go slowly up over time in this fashion. That's a very smooth graph going up. That's how they think your blood sugar is going to go. But here's the problem. I just told you that your pancreas will secrete insulin to move that blood sugar out of the blood and into areas of your body. And it does that in a hockey puck style. It keeps your blood sugar stable at that 1 teaspoon. And it can do that for years, 10 years, 15 years, 20 years. Your pancreas can be working overtime to secrete enough insulin to hide that excess blood sugar in every nook and cranny of your body until you're bloated, overweight, and diseased. This is not a graph that goes up exponentially like this. It's a graph that stays steady, steady, steady until bam, the hockey puck graph. And here is where the blood sugar is high. This is when the medical industry steps in. They have not stepped in more than likely in this area because your pancreas was in there taking care of you all of this time and hoping you would figure out what you're doing wrong before it gets to here. This hockey puck graph, I put down here 5 years, 10 years, 15 years, 20 years. But it could be, based on your lifestyle, it could be 20 years, 25 years, 35 years. And who is it different for? My father, because he was out road bike cycling. So he was burning off the excess sugar, but he was still having his pancreas overworking. By the way, he had to have a 4-way bypass at the age of 83. Now, let's say my father was sedentary. Then maybe this starts off where he's sedentary at 20 years of age, and then he gets to this point here when he's 40. We've had 45-year-olds having bypass surgery. So if you say, but wait a minute, Janina, I thought you said exercise isn't good for weight loss. And I'm correct still. It's not good for weight loss. Exercise is good to defer what's going to come anyways. Exercise can kick the can down the road because if you're not eating when you should and how you should, you're going to end up with disease no matter what you look like. So this is why my father can go in to the doctors during these years and be congratulated by how good he looks because the medical field is looking for this problem here. Never going to happen until it's too late. And that's why medical industry is late to the game. They could be 10 years late. They could be 35 years late. You go to your doctor, you get your blood sugar read, and then they give you this result. And many of you have seen this in your labs where they show the green area is good. The red area is bad. So the doctor may see you and say, oh, Mr. Jones, your blood sugar is fine. But I just told you guys, it's not your blood sugar that's the problem. What could they have measured?
Insulin.
There you go. When a person is in this stage over here, 5, 10, 15 years, when they're in this area, this is when the cholesterol could go up. And that's when the doctor would say, Mr. Jones, blood sugar is good. You don't have diabetes, but your cholesterol is not good. Total cholesterol, now you see it's high here. When it gets to this point, what does the doctor prescribe a patient? A statin. During that period of time where the hockey puck is level, where blood glucose is still fine, your HDL could be too low and your cholesterol could be too high. When you're living in the blue zone right here, pun intended, where meaning that people live longer, you could be in the blue zone where you think everything is fine when these people who live in the blue zone end up getting cancer and they say, oh, it must be genetic or hereditary. No, it wasn't. It's because they hung out in the blue zone, didn't know that they had an insulin problem. But guess what happens when they get up to here? Medical society jumps in and now they have any number of problems. The medical industry measures disease markers, not functional markers. Insulin is a functional marker, but medical industry doesn't measure that. Disease markers are what they measure because they can prescribe medications or surgeries or treatments that spend a lot of money and are invasive rather than allowing you to just reverse the problem by lowering the amount of insulin that your body needs to produce, giving you a false sense of security. Just yesterday, I talked to somebody who said, my doctor said all my biomarkers are fine. So then I asked him, then why are you on the phone with me? And then he went through the list of all the problems that he has. You can guess, high blood pressure, but the doctor said all of his biomarkers are fine. And why does he not consider high blood pressure a problem? Because now he's prescribing him a drug to stay on for the rest of his life. So for the doctor, I gave you a drug, you stay on it for the rest of your life, and now you're out of here. False sense of security. How old were you when you had diverticulitis?
40 something.
You also mentioned that you had appendix issues.
About the same period of time.
That's what happens in this blue zone. So in this blue zone, I'm going to go start with the symptoms: poor sleep, tiredness, mood swings, learning problems, digestive issues, panic attacks, body aches, headaches, breathing problems, irregular periods for females, low sexual desire for females and males. These are just a handful of things that could go wrong during this period of time, but I'm going to guarantee you, most people do not go to doctors right away for any of these problems. They figure, well, something's just not right, but it's not enough to make me go to the doctor yet. Unless, of course, the headache is a migraine, and that's debilitating. They may go see a doctor. Unless the breathing problem turns into where they need asthma inhalers. So now let's go to how the medical industry names these issues here. I'm going to start young. Colicky baby. If the mother gave birth to a child while she was insulin resistant, she's damn lucky she even got pregnant in the first place, because Mother Nature's not stupid to let someone who's insulin resistant have a baby. But let's say medical field steps in to help her be able to have a baby. So that baby may turn up colicky. The kid could have asthma. The kid could have allergies. The kid could have insomnia. The kid could have ADHD. The kid could have autism. The teenager could have anxiety. The teenager or the young adult could have depression, acne, eczema, gastric reflux. As you get older, low testosterone, migraine, seasonal affective disorder, atrial fibrillation, rheumatoid arthritis, diabetes. Can you tell that these diseases are now coming older and older, right? Heart attack, stroke, cancer, dementia, Alzheimer's. These are all terminology that is related to a disease that the medical industry has defined, and all of these come with a medication, a surgery, a procedure. Rather than having taken a look at that hockey puck, the stick part, the linear part, and saying, let's step in here and fix the problem, which Ron correctly stated was insulin was the problem, not the blood sugar. When it comes to this area, the amount of money that's available to treat all of the laundry list of problems I gave you, whether it be a pill, a potion, and when I say a potion, I mean supplementation, because I'm going to throw that in there too. Lots of supplement companies want to capitalize on our fear of what we have going wrong, so they want to prescribe you a non-FDA approved pill, in other words, which is a supplement. But there's a lot of money to be made, and therein lies the problem, which is why you guys need to be the CEO of your own healthcare and say, we're not going to worry about these disease markers. We're going to focus on these functional markers. Now, this is what's wrong with the medical industry. They don't teach the functional markers to your doctor, because the drug companies run the medical industry to make sure they keep doctors that fall in line and continue to practice medicine the way that they want them to for their financial gain, which is why we have the most expensive healthcare and have the worst outcomes in the United States of America for a nation of means. We have everything at our disposal to do functional markers. But people who talk about functional markers get put out into the cold. Taken off of Facebook multiple times. Some of my videos on YouTube also get taken off, which is why I give you guys that are on my email list, I give you guys videos that I can't put out on YouTube because they get blacked out. I hope that the winds of change are going to happen and we'll be able to talk more openly about these things. Functional markers are what are going to keep you out of this area right up here. Part 2. Talk about what happens in this hockey puck area when the blood sugar is high.